Hi, everybody. I'm Laurie Cadden. We're at the Wright Center, the beautiful Wright Center that I found my way to. I'm so happy I got here. You take a girl out of West Side and put her here, you just don't know where you're going, Scott. So
You're
thanks for giving me the little bit of direction. So we're here because we're with the Lackawanna Medical Society's Public Health Education series, which we're doing here again at the Wright Center. We're talking a little bit about, we have two handsome gentlemen with us today. We have Scott Constantini from the Wright Center and Jeff Thomas from Voluntary Center. They're going to talk a little bit about this major opioid crisis that we have, the drug take-back days that they have where we can work together to help drop these drugs off, and also then the collaboration the Voluntary Action Center has with you and your Center for Excellence, Scott. So lots going on. So tell everybody, if you would, your title.
So my name is Scott Constantini. I am the Director of Behavioral Health here at the Wright Center for Primary Care. My responsibilities include overseeing our social work department, behavioral health department, and our Center of Excellence.
And Jeffrey?
Hello, my name is Jeffrey Thomas. I'm the Director of Prevention Services at the Voluntary Action Center. We are a service provider for the Lackawanna County Office of Drug and Alcohol Programs. In respect to medication take-back events, we're allotted 15 a year. Last year we collected over 300 pounds throughout Lackawanna County with collaboration with the Lackawanna County District Attorney's Office as well as the Lackawanna County Police Departments. Currently, next week, in fact, we're having 3 medication take-back events for National Medication Take-Back Day. One is at the Abington Library. The other one is at the North Pocono Library, as well as the Blakely Police Department. Those times are 10 to 2 o'clock, where you could hand in any unused or expired medications, and it's anonymous, just to let you know that. Okay, thank you.
Wow. Well, so tell me, 3 of them coming up, that much in take-back. So medication, explain how the medications are unused stuff. You go to the doctor, you get some type of pain medicine, you don't use it, you don't leave it in your house, you drop it, you take the medications and drop it back. What happens once the stuff is dropped to a location that is with whichever organization is doing this? What happens to the drugs at that point, Jeff?
At this time, it's collected and it is taken down to District Attorney's Office with Chief Jordan. What they do is they weigh the medication. We're given the amounts, we port it through a state system, and then it's properly disposed.
Wow. And that much, I mean, so what, it's actually weighed then, so you know exactly what that is amazing. And what about, how do people, so if there's this epidemic, so help me here, and I'm sure a lot of people would want to know this. There is a raging epidemic. So many people are dropping it, so many people aren't then, right? The differences, and probably more, are just keeping it. What happens? When it comes to the addictive part of it, I understand the medication itself. What happens, though, to the individual, Scott? Once they start, they say, oh, I had surgery, and of course the docs have to look at this because it becomes another vital sign of pain. They get it, they feel better, they feel they can't go without it. Then that buildup starts from there, just like anything else?
Well, I mean, I think what happens is people become dependent. Right,
yes.
on the opioid, right? So typically what we like to do is see prescriptions of opioids used for short-term use, right? So
to help with the initial pain and recovery. Yeah.
Correct, and there are other alternatives out there for pain. I am not an MD,
right?
But I mean, working closely with our doctors and our providers, you know, here at the Wright Center, we really avoid prescribing any type of opiates, and when we have to, it's usually short-term, okay, for short-term use. And then, you know, if the pain exists, the doctors will evaluate with the patient, you know, what are other alternatives to that pain, you know, whether it be physical therapy, whether it be other pain clinics locally that we have partnerships with that will refer them to. But you know, as far as the medication being left in the home after a procedure, it is always best to get rid of it.
Right.
It's not always that individual who's going to abuse it. It could be a cousin, it could be a brother, it could be a daughter, it could be a wife.
Someone who's taking it, right?
Correct.
Yeah.
And you know, so we always encourage patients to, you know, dispose of that properly. I mean, we have a list of sites that are always readily available for individuals to drop these medications off at. in conjunction with the take-back events that Jeff holds. So there are certain municipalities locally that have drop-offs every day.
Yeah, wow.
The county, the courthouse. So, we encourage people, if you're not going to use it, to dispose of it properly, because it will get in the hands, it could get in the hands of someone who is going to abuse it, or, children. That's our bigger concern, is that, children can get their hands on it and take it.
And I know clearly you are not a doctor, we disclose that, but do you, in this epidemic, because you work so closely with this, and Jeff, I'm sure you may know some of these answers too, the fact that, do most people become addicted because they've taken them due to an injury, or it could be they have them and they say, I'm going to pop these things and see what happens? Do you know the answer to that question?
Well, I don't think there is an answer. I
So
think
it could
it's
be
a
either
little
way?
bit of both.
Okay,
Yeah,
okay.
I think that some individuals were introduced to, prescription pills, maybe at a party or a friend was taking them, and then we have the patients who truly have never abused any type of drug, and were introduced to a prescription of opioids during a surgery or some sort of medical procedure, and they became dependent, and they liked the way they felt. We're human. A lot of us struggle with what I like to call brain pain. So, when something numbs
more than
that,
others.
right?
Yeah.
It's a good feeling. It's an escape. It takes us away. We stop thinking about it. So, a lot of individuals, the pain, the physical pain goes away, but so does the brain pain, right? So does the anxiety, the depression, the worry of everyday life goes away. And we become dependent on it, and we continue to take it because we like the way we feel. And now we've become physically dependent on it. So when we try to go off it, what happens is we go through withdrawal.
Sure.
And we don't like the way that feels. So
you up,
now we go for more.
Yeah, and just like any type of
Correct.
dependency. Jeff, the Voluntary Action Center is something near and dear to my heart. I was on the board many years ago. They do wonderful things. I really had no idea. I've been, in full disclosure, been off the board now for many years. But this is a great collaboration between you guys and the Right Center, or the Voluntary Action Center and the Right Center, with these take-backs, and the DA's department and the county. I mean, this is wonderful that you offer this service to people to be able to do this and to promote this so that people understand, let's get rid of it. I think that's something that's so crucial, is getting the public to understand there are places to get rid of your unused prescriptions, and here's what you can do. When did VAC decide that this is something, in your position, Jeff, that you really needed to focus on? Is it just a recent thing because of how crazy this epidemic is, or were you guys a little bit into this prior to that?
Well, the Lackawanna County did a needs assessment, and then we were joined in with a Partner for Success grant, which allowed us to run senior alert programs throughout Lackawanna County. We actually allotted 15 a year. It focuses on proper medication disposal. It talks about personal protection of the environment, FDA guidelines, as well as local programs. Throughout these programs, we focus our sites on the target ages of 55 and older in high-rises, senior centers, medical facilities, as well as the Lackawanna County Library System.
Now, and speaking of that, as you talk, I'm thinking, dependency on drugs, is it a lot in the older population?
Absolutely.
Really, I would never, I would think
absolutely.
it's some, no offense, young, mostly men, and more, if you throw in the female there, but more of a 40 to 50 kind of, I would never think it's elderly.
Yeah, so there was just a recent article put out that showed data that there's been an increase in opiate overdoses in the older population.
Wow.
So, it's something to look at for sure. We don't often look at an elderly person who's 80 years of age who died and do a coroner report to see if they died of an opiate.
Right.
Because we think they died of old age or their chronic condition.
Yeah.
So I think a lot of that doesn't get captured in the data. where I think there's a lot more that do sometimes.
That we don't know about.
Pass away because they got confused and took maybe too many of their pills prescribed. So yeah, I mean, I think that it does occur for sure, and it is definitely increasing. All age levels are increasing right now from what the national data is showing.
So with this awareness and the work that's being done on a county level, state level, a federal level, all of this, I mean, this is, you hear it, you can't listen to the news or open a paper without the awareness is that this is what's going on. What do you think is the most important thing that people can take away from this story that tells you, that could help, that could aid, that could understand? Scott, you and I have done this before. We did a panel discussion for the Commission for Women back in March. We had Shane Scanlon, excuse me, it was actually in May. Shane Scanlon was on the panel, Laureen Cummings, Dr. Dempsey, who works so closely with this, John Knowles, these people, and Julia Munley, because she's dealing with the courts. So that was an incredible event. We also talked about this up at the Abington Memorial Library when we had it, when you and Dr. Dempsey again, and John Knowles came in. But we spoke so, and that was about take back and all these things that go on. What do you, both of you, see as the more we put this out, the better it's going to get, the more understanding people will have? Because we're constantly talking about this. What's going to make the change, do you guys think, that people will understand? A, they can get rid of their drugs. Just for the first, right off the bat, you have a pain medicine, you're not going to use it, get rid of it. Right. Do you think a lot of people hold on to it thinking, well, I'm okay right now, but maybe next week I won't feel as good? Do you think, because I don't think that people consciously, maybe I'm wrong, that they're thinking, oh, I'm just going to keep doing this. Especially someone who keeps it in their medicine cabinet instead of getting rid of it. Hey, I'll use it next week. Right.
So I think for some people that might be the case, but I think for others it might be that they don't know what to do with it.
Okay, so they just leave it there.
They don't want to flush it down the toilet. Right. They don't want to throw it in their garbage can, but they don't know where there are drop-off stations. So I think that one of the things that, that this is very beneficial, that we can let people know where to take it. Okay. And if you don't know where to take it, call your pharmacy. Your pharmacy can probably put you in contact with Jeff Thomas. So, and let you know where there's take-back events. There is always a place to drop the medication off. Okay. Right? So I don't think that there's one answer. I think that there's many answers.
Can we go round and round on this? I know.
Absolutely. I just think that this isn't a family issue. Addiction's not a family issue. It's a community issue right now. Yeah. It's affecting the nation. It's affecting all walks of life. Yeah. So scary. I think that the more education that we can put out to the community, and the community can come together and fight this crisis together, and start lifting the stigma and telling people it's okay to get help, right? A lot of people are still living in the shadows, because they want to hide the monster under the bed, right?
Family does, or they do.
That's right. I know. So I think that, Jeff's agency does a really good job with prevention work and educating individuals on addiction, on, drug take-backs. And I think that it's about a village coming together. Yeah. I constantly say that, but it's the truth. Yeah. So there isn't one answer.
And it's just like anything else. So Jeff, tell everybody then, if they want to call, how would they get in touch with you, the Voluntary Action Center, to plan? Because you're doing these ongoing take-backs, right, Jeff? So this will be something that someone can get to. If they needed you to come and talk to them, they needed information or help, as Scott was just saying that you guys provide, please let everybody know how they would do that.
I'd just like to back up on one point that Scott made. In regards to prescription drug abuse, statistics show nationally that 75% of illegally obtained prescription drugs, you get it from a family or a friend. So you guys...
75%?
75%. Wow. So in regards to getting rid of this medication, you need to get it out of your home. Now, Lori brought up a point about throughout Lackawanna County, there's actually 4 stationary boxes located in Lackawanna County. The hours of operation are 8 to 4 o'clock. The one is in Carbondale Police Department. There's one in Moscow Police Department. There's one in South Abington Township Building, as well as the one in the Sheriff's Office as well.
That's amazing. I had, even in all these things we've done, I didn't even realize that. So see, Jeff, this is all good information. So Scott, talk a little bit too, if you would, about the Center of Excellence and what you do here, and why again, it was important for the Right Center to deal directly with the Voluntary Action Center on this, for this cause, and let everybody know what goes on. This is an amazing place,
Right.
if I can get here on the next time when I'm here. But this is a wonderful place, and everything that goes on. Actually, I just was with John Carney a little bit. He's on your board, and he loves this place, and we were talking about it, and the stuff that goes on here is incredible.
So first, I think I want to just comment about the partnerships that we have. We have many community partnerships. We believe in community partnerships because we are a part of the community. So Voluntary Action Center, we look at as a community partner of ours. So we need to tap into what they're specializing in. So prevention, education. Actually, me and Jeff are planning an educational event for our staff, where they have a program that they come out and they educate individuals on various topics of drug abuse, prescription drug abuse, the take-back programs. So I think that it's important that we even tap into, Jeff, not just for our patients, but also our staff. Right?
Sure.
So they're aware of what services Voluntary Action Center provides. So our Center of Excellence is a Center of Excellence for Opioid Use Disorder. So we were awarded that back in August of last year. We learned about it. Actually, it was my first day at work, so it was August 29th. So, and I won't forget that.
No,
so, but the blast off for it was January 1st.
Okay.
So this upcoming January will be open a year in helping individuals with opioid use disorder. That does not mean that we don't help individuals get the proper resources for other addictions, because we have many patients here that struggle with, alcoholism or other addictions. So we tap into, again, to our community partners to get them the help needed, if it's specialties in counseling, whether it be drug and alcohol outpatient, specialties in mental health counseling, whether it be an inpatient or outpatient. So one of the things that we're doing here under the Centers of Excellence is we're bringing these individuals in, we're assessing their needs. What do they need right now, right? Where are they at? Do they need an inpatient facility? Do they need a detox facility to detox from the medication? From there, we have services here. We are one of 19 physical health centers of excellence in the state of Pennsylvania. And one of those goals was for us to expand medication-assisted treatment, okay? So that is not always our first line of defense. We offer many things. Many of our patients need just a case manager to help navigate them in the community. They need a certified recovery specialist who will work on them on a recovery plan in the community, get them to AA meetings, get them to NA meetings, other supports, other recovery supports. We make proper referrals for all kinds of socioeconomic barriers, such as housing, such as they don't have insurance, such as they need a job. So we're bringing these individuals in, and we're doing a lot of groundwork with them to try to get them out of that rut.
When you were given that designation, how long did it take for this center to get the designation?
So I think that the original application, from what I was told, was filed in the spring.
Okay.
And
They heard by the beginning of the year?
Yeah, it might have been April-ish. It was of 2016. They were awarded it in August. They were told they got it, and we opened the doors up and assembled the team for January 1st.
So to do that then, as you're saying, then you've got to continue to meet all of these standards on a yearly.
Yes.
Is it yearly that you're reviewed, or you have to submit information?
Monthly.
Wow.
So we have data that has to be reported to the state of Pennsylvania monthly regarding our patients, regarding new patients, existing patients, if they're actively engaged in the program, if they're going to counseling. So there's a lot to the data that we report. So,
And the number of people you've got, I
Correct.
mean, sure, but I had no idea that this place and everything it does was that detailed in getting people and you working with as many community partners as there are out there. And this is huge.
yeah, so I mean, we try to tap in, as many community partners as we can. So we don't have a tool for every problem.
Yeah.
So it's
We
our
wish we did.
no, we don't,
yeah.
and we're okay with saying that.
Yeah.
We do have a lot of tools here at the Wright Center because we are a health home model, and we have a lot of great things happening here. One of our goals was to expand medication-assisted treatment, and when we started in January, we only had 2 providers. Well, December, our first provider was approved by the DEA, and then the end of December, our second provider was approved, and as of today, we have 10 providers approved to provide medication-assisted treatment. We are very structured. So, when I say very structured, we put a lot into that structure as far as, individuals who are receiving medication-assisted treatment through our facility have to be in counseling. They have to be checking in. They have to be compliant with the program. For many reasons.
Yeah.
So,
Well, it just makes good sense.
absolutely.
So if you would do me a favor, and each of you, Jeff, if you'd pass the mic to Jeff and let him tell the people, our viewers, how it is they can get in touch with you guys for anything they may need.
The Voluntary Action Center, I could be contacted at area code 570-347-5616, extension 213. Once again, it's Jeffrey Thomas, and our physical location is 829 Jefferson Avenue, Scranton, Pennsylvania.
There we go. And you too, Mr. Constantine?
So here at the Wright Center for Primary Care, I could be contacted at 570-230-0019, and our address is at 5 South Washington Avenue in German. If you have any family members or yourself struggling with opiate use disorder, or you're struggling with other addictions, please give us a call. Again, 570-230-0019.
Anything else that you would like to add that I didn't cover, each of you, before we close? You good, you good there, Scott and Jeff?
Yeah,
All right.
I'm good.
All right, there we go. Thank you so much.
Thank you.
I appreciate
Thanks for your time. We had a good little chat here,
Thank
as
you.
usual. Okay, so that's your information, folks. If you need Jeff or you need Scott, at the Wright Center, you can go out the website or the Voluntary Action Center. Please use the services. They're here. If you know anyone who needs help, as they said, please feel free to get in touch with them. And remember that those take-back locations, 4 of them, as Jeff mentioned, are available. What are the hours again, Jeff?
8 through 4.
8 to 4, and those several locations, Carbondale, Moscow, Scranton, and Clark Summit, right? There we go. So again, thank you guys. Thanks for
Thank you.
joining me.
Thank you.
And we'll be back next month with another one of our informational shows for you. Again, this is provided in part by a grant from CHS. We thank you for listening. Stay tuned next month. This is the Lackawanna Medical Society's Public Health Education Series. I'm Laurie Cadden, and thanks for listening.